Hello, OET champions. Do you know why most OET students lose marks even when they know the case notes in OET writing? It's not because of grammar, it's because of weak sentence formation. And here's the good news. Today I'm giving you 50 powerful OET writing sentences used by top scoring candidates, phrases that make your letter professional, clinical, and you score 450 plus easily. So stay till end of my video to get the best benefit of this. I'm Dr. Arshnu from Dr. Arshnu's OET Institute, helping healthcare professionals express with clarity, confidence, and compassion. If you are preparing for OET writing, this video will transform the way you write your admission, hospitalization, and recovery paragraphs. Now, let's dive deep into this. But before that, if you have not subscribed my channel yet, subscribe it right now to get the notification of upcoming videos. First part which I'm taking today, that is on admission. Let's see the examples. Here are some excellent sentences you can use when the patient is admitted to the hospital. The patient was admitted with complaints of severe abdominal pain and vomiting. On admission, her vital signs were stable and she was afebrile. The initial assessment revealed tenderness in the right lower quadrant. A provisional diagnosis of acute appendicitis was made based on clinical findings. Baseline investigations, including CBC, renal profile, and urine analysis, were performed. An IV line was secured and fluids were commenced. The patient was kept nil by mouth pending evaluation. Pain management was initiated using paracetamol and IV fluids. Consent was obtained after explaining the procedure. Chest X-ray and ECG were carried out to rule out preoperative risks. She was shifted to the surgical ward for close observation. The patient appeared anxious and was reassured. Monitoring of input and output was started. Nursing staff were advised to observe for any signs of deterioration. A multidisciplinary review was arranged. Her past medical history was unremarkable except for hypertension. On admission, she was oriented to time, place, and person. These were 17 sentences which I have given to you on admission. What type of sentences you need to write at that time. Now, the second part is during hospitalization. Let's move to the body paragraph, how to describe the hospital course clearly and logically. 18 sentences, the patient responded well to the prescribed medicines. 19, she remained hemodynamically stable throughout her stay. Regular vital signs monitoring was carried out. The wound site was clean and dry. IV antibiotics were continued as her physician's order. The patient tolerated oral intake gradually. Physiotherapy sessions were initiated to promote early ambulation. She was encouraged to perform deep breathing exercises. Blood sugar levels were monitored regularly. The patient reported mild discomfort managed with analgesics. Progress notes indicated steady improvement. The care plan was reviewed daily. She was educated on wound care and hygiene practices. The catheter was removed once urine output stabilized. Follow-up lab showed normalization of parameters. The patient participated actively in her recovery process. Family members were kept informed about her progress. Physiological support was offered to reduce anxiety. When describing hospitalization, use clinical tone, chronological flow, avoid storytelling, focus on facts, and care progression. Now, the third part is recovery and discharge. Finally, the recovery and discharge section. This is where you show positive outcomes and follow up instructions. The patient showed remarkable improvement and was fit for discharge. She was afebrile and ambulatory without assistance. The wound had healed satisfactorily. She was advised to continue oral antibiotics for 5 days. Discharge instructions regarding diet, medications, and follow up were explained. The patient was counseled to avoid strenuous activity. Warning signs of infection were clearly explained. A follow up visit was scheduled after 1 week. She was advised to maintain hydration and balanced diet. The patient expressed satisfaction with the care provided. The prognosis was favorable. She was encouraged to resume normal activities gradually. The discharge summary included medications, details, and review date. Referral to a community nurse was made for home care. The patient was clinically stable and optimistic at discharge. And your letter with assurance, ongoing care, and professional closure. That's what examiner love. Now, here is a bonus writing tip. Want to impress the examiner? Always use linking phrases like in view of her condition, given the above findings, or considering her current stability to connect your ideas smoothly. If you found these sentences useful, don't just listen. Practice writing one letter daily using them. Comment below with I am ready to score 400 plus in OET writing. Don't forget to like, share, and subscribe to this channel because every week I help you speak, write, and shine like a magnetic medical professional. This is Dr. ARSHNOOR, your OET fluency and communication guide. Now, this was all about today's writing tips. I'll be there with new video very soon. Till then, happy learning, stay connected. And if you want me to make some video on particular topic, must write me in comment box. Thanks for watching. See you very soon with a new video.